A lot of organisations have found that engagement with their nurses has been difficult since the introduction of revalidation. Correlation between nurse engagement and patient care has been found by having nurses that are more engaged, they're more productive, they have better improved health, and organisations have therefore found a lower level of absences within their support team. Teamwork and more communication, face-to-face events have been very beneficial, getting the nurses involved and integrated into the entire workforce team. So not just within their appraisal but throughout the year, managers should be providing feedback on learning outcomes, learning needs, and meeting with their staff on a regular basis to provide that feedback and having a discussion on if the nurse needs to progress, especially to assist with meeting any revalidation requirements. So by the time the appraisal comes around, they've met several times throughout the year, they've had several one-to-ones, and any training outcomes from that or feedback would already have been made aware of. Having a dedicated revalidation champion or lead within each organisation is hugely beneficial. They can then dedicate that particular role to supporting nurses throughout the entire organisation through revalidation requirements, doing training needs analysis, looking people on to training and learning, but also to help people prepare for their appraisal meetings as well, because revalidation and appraisals are very closely entwined with each other. So going back to some of the revalidation requirements, one of the requirements is participatory learning. So if you take e-learning as an example, it's usually considered to be quite a isolated activity. Thinking outside the box, it can be done as a pair or as a small group. Do a piece of e-learning together, it then becomes participatory learning, and you can even reflect, discuss and provide feedback to each other at the same time, and that also will once again bring that team together. So these are some of the top tips and hints that we've received from different events we've attended and run, or training sessions conducted. They're tips that the nurses have felt that they would find useful from their organisation to help support them, but they're also things that the organisation would like to do more of to assist with the nurses in their roles to engage